Let's have a look now at the latest developments in the coronavirus pandemic. The Italian government is easing travel restrictions, allowing people to move freely inside their home region as of Monday and between regions starting June 3rd. India has surpassed China's tally of confirmed infections with nearly 86,000 cases. Russian health authorities say they have registered an additional 9,200 coronavirus infections in the past 24 hours. Moving on to Brazil now, where the new health minister has quit after less than a month on the job. His departure comes as the coronavirus pandemic rages in the country, with hospitals overwhelmed in several cities. Despite the spread of COVID-19, Brazil's far-right president, Jair Bolsanaro, continues to downplay the virus and opposes lockdown measures.
As Brazil struggles to fight the pandemic, the country has become one of the world's hotspots for COVID-19, with the death toll now surpassing 800 people a day. So the health minister's resignation could not come at a worse time.
Life is made of choices, and today I chose to leave. I can say that I gave the best of myself the days that I was here, during this period. It is not simple to be in a ministry like this one during such a difficult period.
Teich didn't give any reason for his decision, but it's been clear he disagreed with President Jair Bolsonaro's promotion of a controversial anti-malaria drug to fight COVID-19 and his push to reopen the economy.
Are people dying? Yes, they are, and I regret that. But many more are going to die if the economy continues to be restricted.
A recent poll shows 1/3 of voters still back the president, but more and more Brazilians are unhappy with how he's dealing with the pandemic. News of the health minister's resignation prompted pot-banging protests in major cities. Demonstrators accuse Bolsonaro of recklessness and failing to save lives.
The number of India's confirmed coronavirus cases has surpassed China's, climbing to nearly 86,000 infections. But so far, the death rate in India appears better compared to China. Indian health officials say that could be because most people infected were either asymptomatic or had mild symptoms. The country's swift and fast shutdown is also credited with preventing a worse outbreak. The government is set to decide on whether to extend India's nearly 7-week lockdown. Well, for more on this now, I'm joined by India correspondent Nimisha Jaiswal from Delhi. Nimisha, the caseload is higher than in China now. Does this mean the country's likely to extend lockdown measures?
Well, Rebecca, it looks like the opposite, in fact, right now. India's third phase of its long lockdown ends tomorrow on Sunday, and the Prime Minister has indicated that further easing is likely on Monday. Already over the last 2 weeks, people have been allowed to come out more in private vehicles. Offices have started off in some capacity, and it seems that the fourth phase actually might bring some limited public transport back on the roads. Trains have already started running. It seems that the government seems fairly confident despite the high caseload, again, perhaps indicating the low death rate and the high recovery rate in India as the reason why it feels this way.
Now, we're getting some early word from the AFP news agency about the conditions in one of Mumbai's hospitals, that they're particularly devastating there. How is the Indian health system coping with this situation?
That's right, Rebecca. That actually is the concerning matter, given that easing is happening. The government has reiterated that India is ramping up infrastructure and even increasing its PPE production capacities. And we have the capital, New Delhi, saying that open up everything because they feel they have ramped up infrastructure enough that they will be able to handle a spike. But then we have reports like the Mumbai hospital you speak of, where they're saying Mumbai has run out of beds. Maharashtra, the state Mumbai is in, has over 1/3 of India's cases. They're saying that body bags lying in hospitals alongside patients. And this is, of course, very concerning. And we'll again have to wait to see what exactly is actually going to be the direction places like Mumbai take, given how intense the outbreak is there.
Now, the poor, unsurprisingly, have been particularly hard hit, especially migrant workers. We've seen lots of devastating cases. Is help on the way?
Well, Rebecca, the government has announced a stimulus package, which it claims is 10% of India's GDP. This is targeted at small businesses, farmers, and migrants. There's going to be free food grain distributed, for example. But again and again, we've seen devastating visuals of an exodus from India's urban centers of rural migrants. The government has started up trains and buses over the last couple of weeks, but people are still hanging on by all means of transport to try to get home. Just earlier today, 24 migrants lost their lives in a road accident. Over the last 2 weeks, there have been similar deaths reported, over 50 deaths across the country. So definitely the help that is on the way needs to get to these people more urgently, and transport needs to be arranged so that they can safely get home without infecting others, but also make it back to their loved ones.
Nimisha Jaiswal speaking to us from Delhi. Thanks very much.